The problem is there is no one standing up for the patients, and that's why Patients USA.
Yeah.
And you've got another video. I want our viewers to see this other video because it really is pretty funny, and it stars the empty chair. It's like Clint Eastwood had the empty chair. The empty chair is the patient. So let's stop a second and watch that.
What the heck are you guys doing? You guys have been throwing money at the Senate and the House for decades. $250 million amongst you just the last year alone. And what do we get for it? This, the bill's not working for American people. And what's the deal with the empty chair? Why isn't the patient at this table?
Senator, we patients may not have a lot of money, but we do have lots and lots of votes.
There's a patient-driven healthcare plan being crafted in an undisclosed location deep in the Rocky Mountains, where the corrosive influence of the corrupting lobbying efforts of the drug companies, hospitals, and insurance companies can't find us. One of the key features we want to start with, and keep it simple, just get one line legislation passed, quote, every provider of healthcare services or product is required to post prices, close quote. We need to get behind that, but it's not going to work unless you join Patients USA. We need you. Join us.
So that makes the point. If the patient is in the room, it makes a big difference. And Patients USA, you're putting the patient in the room. You're giving them the ability to see the costs. Now we talk about third-party payer, and we had Bob McEwen in, former congressman.
Sure.
I believe is a good friend of yours.
Yes, absolutely.
Tremendous man. Bob talks about, in the case of a third-party payer, the third-party payer doesn't care about the price, and they don't care about the quality.
No.
And yet, third-party payer is single payer, and that's what the collectivist system wants to foist on all of us.
Well, if you take the term single payer, public option, Medicare for all, those are all code words for government takeover of the healthcare system. Now, what does the government currently run? They have the military health system where you have probably zero choice.
VA, yeah.
And you have the Veterans Administration Hospital where you've had a lot of scandals on accessibility, waiting, long waits. And then you have the Indian healthcare system the government runs. You don't see any planes coming from foreign countries to land on a reservation for a new heart valve.
No.
So why do we want to take all these wonderful institutions, MD Anderson, Sloan Kettering, Mayo Clinic, and take away that as a private enterprise where we can choose and find out which one we got to go to, and get rid of that and put it on top of the government's balance sheet, which is already grease-like. If you take 8 zeros, Kevin, off of the government numbers, you can log on the debt clock,
right?
And you can see these numbers spinning.
Yep.
If you take 8 zeros off the government numbers so you can compare it to a Kevin Freeman, you have a $35,000 income,
right,
a $47,000 outflow expenses on a $230,000 credit card tab. Now,
that's not sustainable.
No, it's not going to be hard for these young kids who have been brainwashed about how wonderful it is for free medical care, and also this whole idea about free education, free health care. They don't realize it's only free when you're in college age and getting it. But once you get to be 25, 26 and have a job, in Denmark they have a tax rate that gets as high as 60%, on top of a 25% sales tax, on top of 180 excise tests if you want to buy a car.
That
so
free is going to cost you the rest of your life.
The rest of your life.
Yeah, there's no question.